Hey guys, Congresswoman Kat Cammack here. Yesterday, the Democrats walked out of our hearing in Energy and Commerce over an amendment that would prohibit funding for adolescent gender reassignment surgery at children's hospitals. You heard it right. No taxpayer funding for gender reassignment surgeries caused the Democrats to walk out. This is a really, really tough issue. And instead of sticking it out, having a dialogue, they turned their backs and walked out. So check this video out. It is totally worth the watch. It really shows just how far we have to go in getting this country back on track.
Chair recognizes Ms. Cammack for 5 minutes on the amendment.
Thank you, Madam Chairwoman. I am so grateful to my colleagues, Representative Crenshaw for his leadership on this bill, and all of my colleagues here who are supporting funding for our children's hospitals. I want to reiterate again that nothing in this bill would prohibit a child with gender dysphoria from receiving proper mental and behavioral health care services. The underlying text is limited to experimental medical intervention, specifically using puberty blockers, hormone therapies, and surgeries to change a child's gender. And it was mentioned several times from my colleagues on the other side of the aisle that we don't understand this process. And so for the sake of clarity, really, I'd like to show a video, a brief interview that was conducted by an expert in gender reassignment surgeries from Oregon's healthcare system.
Madam Chair.
Madam Chair.
I object. I move that the committee adjourn. This has turned into a circus. I move that the committee be adjourned.
It's official. It's official testimony.
Madam Chair, can I just ask?
Madam Chair, without objection, I would like to play this
Committee
video.
will come to order.
I was going
Motion to adjourn is not debatable, right? So I have to ask. Okay, so Ms. Cammack controls the time. She gets her 5 minutes, and then we'll move to the vote on the motion to adjourn.
We don't want to be held hostage by whatever it is that you guys are.
My
committee will come to order.
So
Ms. Cammack controls the time. Ms. Cammack controls the time.
Thank you, Madam Chairman, Chairwoman. Without objection, I would like to.
I object.
Oh, there's an objection.
I object. We have no foundation or basis for this video. We haven't seen it, and
It's a medical expert from your side.
we've not seen it, but I object.
If we don't as you claim, if we do not understand how this surgeries work, I would like to show a video that articulates how these surgeries are conducted. I think that is completely germane to the conversation that we are having here today.
Okay. Just, excuse me. Lady will suspend. Committee will come to order. Okay, so Ms. Cammack gets to finish her 5 minutes, and then we will proceed.
Thank you. Please play the video.
So you objected to the video.
It's an interview.
Okay. Committee stands at recess while the minority gets to look at the video.
I want to look at the video.
2 minutes and 17 seconds.
Committee will come to order. Ms. Cammack had asked unanimous consent for the committee to watch the video. There was an objection. I'm going to yield now to Mr. Pallone for the purposes of his objection.
I looked at the video, but I insist on my objection because I have to be honest, I don't even understand what the person is saying. It's all, to me, it's just almost impossible for us to understand what he's saying and how it relates to what we're discussing here. Even the authentication is difficult, so I insist on the objection, Madam Chair.
Instead of a unanimous consent, the committee, I'm going to ask then that the committee vote as to whether or not to see the video. The clerk will report the vote.
Chair Rogers, on that vote, there are 26 ayes and 18 noes.
The ayes have it. We will watch the video.
We're going to leave. We'll come back.
Okay.
But the one thing that is very new is genital surgery in someone that has underwent pubertal suppression. I do facial, chest surgery, and genital surgery. But the majority of my practice and sort of where my passion lies is really genital surgery cases. So I do a lot of vaginoplasty and a lot of phalloplasty. I would just say they're expanding in either direction. So yeah, a lot of adolescents presenting for surgical intervention, but also a lot of people that are like in their 70s sometimes coming in for genital surgery, and then everything in between. But the adolescents for sure present some unique challenges. Obviously, there's great evidence supporting pubertal suppression for a whole variety of benefits. But the one thing that is very new is genital surgery in someone that has underwent pubertal suppression. Not so much an issue in someone with assigned female at birth anatomy that undergoes a phalloplasty, because we're creating something with a free tissue transfer or a flap anyway, but a much bigger issue for an individual that's undergoing a penile inversion vaginoplasty. Because we use all of that tissue to basically create the vulva as well as line the internal vaginal canal. And as a specialty, those of us that do a fairly high volume of genital gender affirming surgery, we've maybe done a handful of pubertally suppressed adolescents as a field, and no one's published on it yet. OHSU we're just putting our first series together as we're kind of learning and figuring out what works. But it's really changing things because you don't have enough tissue to line the vaginal canal. So you either have to take a skin graft or take skin from elsewhere or use some artificial product. The way that we're dealing with it is by using a robot, and we're basically performing intra-abdominal components of the surgery. So we're using peritoneum, which is the inner lining of the abdomen, to line most of the vaginal canal. And by doing that, that allows us to use all of the remaining tissue externally to create a vulva and try to make also an aesthetic result.
Last week from Dr. Blair Peters, who is a gender affirming surgery expert at the University of Oregon's Health and Science Division. Earlier today, just a few minutes ago, our colleagues on the left said that we didn't know what we were talking about. So when presented with a video that details exactly what it means to conduct surgery on a minor for gender-affirming surgery, they left the room. They don't want the facts. And as you heard from the specialist who does these surgeries, they don't know what they don't know. They don't understand the long-term effects. There is not even published information, peer-reviewed information backing up the claims that our colleagues on the left have said. We are here today to fund children's hospitals, not to mutilate them with experimental surgeries that we do not have science and data that backs up the claims that the left has made today. So I stand with my colleagues in funding these children's hospitals, but I also am very disappointed in my colleagues on the left who opted to leave the room in protest and refuse to watch a video from an expert on their own side. With that, Madam Chairwoman, I thank you for allowing me to show this video, and I yield back.
Gentlelady yields back. Further discussion on the amendment? Seeing none, the vote occurs on the Schreier amendment. All those in favor say aye. Aye. Those opposed, nay. Nays have it. A recorded vote has been requested. The clerk will call the roll. Clerk will report the vote.
Chair Rogers, on that vote, there were 17 ayes and 26 noes.
The noes have it, and the amendment is not agreed to.